Hi, everybody. Today we're going to talk about auditing a usability engineering file. In the past, we've talked about usability and human factors in lots of cases. And a lot of people think, well, all I have to do is provide them a report for the usability validation that we've done. And that's not correct. Number one, in order to meet all the requirements for an FDA submission, whether it's a 510K or it's a de novo or some other type of submission, you're going to have to provide the FDA not only the final report, but you're going to also have to provide the documents that helped you get there. So they're going to ask for, where's the protocol for the report? Where's the raw data for the report? They're also going to ask you, where's the use-related risk analysis where you identified what tasks are critical tasks, because those are the ones that you have to validate. If it's part of the normal workflow, you're going to perform the other tasks. You're not going to skip steps. But if those critical tasks aren't covered in your validation, then it wouldn't be acceptable. So you need to make sure that you provide that URRA, the use-related risk analysis, and that's a special format of a usability trace matrix. Normally, we talk about a risk analysis document, such as an FMEA. For usability, they have something called a uFMEA. So that's what you would normally use to do your risk analysis for use-related risks, but the FDA doesn't want that format. They want less information, and they want it in a specific format so they don't have to learn whatever you came up with. They want you to conform with the way they expect to see that trace matrix. So they've published in a draft guidance document from 2022, hey, this is what we want. We want a use-related risk analysis. And I can actually pull that up on my screen here. So let me do that right now. I just got to present here. So present, share, entire screen. Boom. Okay. And we'll make it a little bit easier so you can see a little bit of me. So here's the guidance the FDA came up with. And it's a draft guidance from 2022. And they even have a flow chart in here when you should do some of these tasks. But I'm trying to get to the use-related risk analysis. So here's actually their URRA. And this has more information than you need because it has an existing device and a modified device. This is all they're looking for you to submit right here in this table 2. Submit table 2 to the FDA. That's what they're looking for. So they just want those columns. They want them labeled only that way. Don't give us any more information. Don't give us any less information. That's all they want. And I can even blow it up there for you a little bit. There we go. That's much better. So table 2, that's what they're looking for. And we have a template for that. So we actually have a whole entire folder of usability items. And we have 2 different formats, an Excel spreadsheet and a Word document. I'm going to pull up the Excel spreadsheet. That's the one I prefer to do. When you have software devices that you're working with, sometimes the files are they have so many different line items that you want to sort through them and categorize them and do different things like that. So this is our version in an Excel spreadsheet that we created. So we would use this. But that's just one more of the things. So you needed the report, you needed the protocol, you needed the raw data, you needed the use-related risk analysis. What comes before that? Well, you want to identify the tasks. So you're probably going to need a task analysis too. Well, we have our report template here. We have a protocol template here. We have the URRA. We have a Word version for those of you that don't like Excel spreadsheets, those non-engineers out there. We have a task analysis. So that's another document. It would just walk you through, like if you were doing a walkthrough of your instruction for use, step by step, what do you do one by one? They sometimes call that a cognitive walkthrough. But most people are just walking through the IFU and going step by step. And if you did your IFU really well, it's got actually numbered steps. They also are going to expect you to identify what the known use errors are out there. So we have a special document just for documenting known use errors that were found in a database search. So you'd look through the MAUD database, you'd look through the TPLC database, you'd look at recalls, You'd look at other countries. You'd look at your own post-market data if you had any previous versions on the market. If you don't, you might search what competitors had out there. What is your predicate if you're doing a 510K? And you would gather all that information and summarize it in a report. This is what we found for um, use errors that exist out there ready for the product. And then last but not least, because I've been working backwards to the very beginning, the first thing you should be doing is identifying use specifications. And we use the name that the FDA came up with, the device, the product device user system. So what they want is the indications for use. They want the intended use environment, the intended patient population, the intended user groups. Feel like and the device user interface. So does it have a knob? Does it have a switch? Does it have a touch screen? Those are the things that they want in the use specification. So all those are the documents the FDA wants. Well, they don't have it really spelled out in a guidance document. This is what you should submit. They haven't incorporated that into the E-Star yet. And if you'll remember, for cybersecurity, they didn't do that for a long time. Back in, I think it was like 2014 or so, they had a cybersecurity guidance. Then it was in 2018, they came out with a draft, but people complained about that one. They came out with another draft in 2021, and then they finalized it in 2023. And then finally in January of 2024, they finally released an FDA E-Star that incorporated all those attachments and things that they wanted for the cybersecurity. So we're expecting the same kind of sequence of events for human factors. We're expecting them the first to come out with a draft guidance. They already came out with a draft. We expect that to be revised based on feedback because it didn't get approved right away. Then we expect the final version to be released. Then we expect after the final version is released, then they will finally update the E-Star. And so we're trying to work on anticipating what that will look like and what they want. But these 6 documents, we have them marked as number 1, 2, 3, 4, 5, 6. I apologize that this is probably so small to read. Can I blow it up anyway? View. I guess that's going to waste too much time. So you're going to have to deal with small. My apologies. Maybe I can blow up a little bit bigger. Nope, I can't. So those are the 6 documents we expect, but those all should be in a usability engineering file. And there actually is a standard that you should be following. It's IEC 62366. And that should be the standard that you're following for building your usability engineering file. So if you're doing anything in Europe, you're going to have to provide that as part of state of the art for your technical file. And the usability engineering file is just a piece of that. So when you have people that are thinking, what do I need to have in this usability engineering file? There's a standard. So here's the standard right here. IEC, this one says EN 62366 because it's the European version, but it's -1. It's a 2015 standard. They amended in 2022. And things are in here where it says, like, usability engineering file is on page 16, and it says what should be in there. And it says compliance is checked by inspection of the usability engineering file right here. And all the results of this process, this usability process, are supposed to be in that file. A little bit further down, they have, say, prepare a use specification. And once again, at the bottom, they say compliance is checked by inspection of the usability file. So throughout this guidance document, they're having different requirements that you should include. Well, how do I know what should be in my usability engineering file? You can just search for wherever it says usability engineering file. That's going to be where a requirement is found, and they're bolded in italics. So you can just search for all the places that's been required, and then hey, I have to include that in my usability engineering file, and they're going to be checking that when they do an audit. This is like if you're doing a notified body audit. When Then other time that you might be required, well, actually not might, you will be required to provide a usability engineering file is when you do electrical safety testing. When you get certified for electrical safety, they have an IEC 60601-1-6 standard that's usability. And one of the things the testing lab will give you is a checklist. They'll say, where can we find all the things that are required for usability in your usability engineering file? Here's a checklist. Please fill it in. And it's according to this standard. So all the things are in there. So we need a checklist that tells us what are the things required, and we create that by doing this search for usability engineering file. Well, I had my assistant already do this for me, which is kind of cool. And let's see, it's right here. And we'll blow that up so you can see it real well. So this is the checklist, and it references the standard in the version of the standard. And here it is. We've actually got the clauses on the left-hand side, and we've got some optional clauses, and we explain that's for user interfaces of unknown provenance. That means somebody developed it long before and they didn't document it. Why? Because usability standard didn't exist back then. Or it was developed by another company that wasn't medical. That could be another reason. But all these things are required. We say which clause it's required in. We use the exact wording right from the standard. So you could go through this each section, just like you would in a normal audit, say, do they meet this clause? Do they meet this clause? Do they meet this clause? And that's called the element approach of auditing. You would go through each one and make sure that they've done everything they're supposed to do. So that's in general your strategy. You figure out what the requirements are. You would go clause by clause through them, make sure all that, but there is another way you can do it, and that is the process approach. And I don't know how well this is going to work for me. I was trying a little bit earlier and I was having some problems. So I'm going to try to share my screen. Connect with the app. Huh. Come on, let me share. View. Come on, let me share. Guess I'm not going to be able to share my screen. I was hoping that I could. Okay. So if we can't share our screen, we'll try one more time here. Stop. Try one more time. Ooh, maybe I can do it that way. No, it's not going to cooperate. Well, I'll probably have to uninstall and reinstall again to try to get that shared. But I will try another way of doing this. I will try it on just another piece of software and see if that helps. My apologies for the delay here. Okay. So we're going to try this tool instead and see if that works okay. So hopefully you can see my screen well enough here. I'm doing a little mind map, and we need to blow that up a little bit so you can see a little better. So the main topic here, I'm using a mind map tool instead of doing this with um, my fancy writing tablet. So we'll just do it the old fashioned way. The first thing that we're going to do, the first step, is you want to describe, and I should probably number this, step one, we're going to describe the human factors process. So how do you build your usability engineering file? So that's step one. You interview the person, you just ask them to describe the process. Okay? The second step that you want to do is you want to ask the person, what are the inputs to this process? So we're going to try to move this over to the other side. Will it let me? It's not going to let me. So we're going to have to keep them all on one side. Normally we have them on the other side. There must be a way to do that. Come on. We'll try this. Okay, number one is that. So the first thing that we were going to look at was describe the human factors process. Second step is, what are your inputs? Now for inputs, this is going to be our use specification. Okay? And that would be step two in our human factors process. Step three in our human factors process, we're going to try to identify what known use errors are. But when we're doing a process approach to auditing, we have the inputs. We want to know what the final outputs are. So step three, the outputs of the process, that's going to be our usability engineering file. Okay? The fourth thing that we look for when we do a turtle diagram or a process approach to auditing, we have our inputs to the process, that's a use specification. We have our outputs, which is the usability engineering file. And then our third item that we're going to want in this process is we're going to want to know what what kind of software tools or what kind of calibration we're going to use, what kind of equipment we're going to use. Is there anything that requires validation, calibration, maintenance that would be necessary for this process? Well, because this is an administrative process, it's on paper or in the cloud, the only thing that we would really have would be software. So what you might have here would be templates, but that would be covered under how you do it. So the only thing you might really have here is some sort of QM quality management system software. That might be the only thing that you have that would be involved in here. You don't really have anything else in that for that particular one, and this should be an item number 4. You might have to do validation, software tool validation. Okay. The next thing that we would have, after that, and it's not going to let me do it any other way. The next thing we would have after the software tool validation would be who is going to perform this process. So we're interviewing the person that's the process owner. We say, hey, who's going to be working on this process? Can you tell me what their role is, what they're responsible for? So you'd have some training. And you would identify who the people are. So who, training, and roles. Okay. And we have a couple of people here that said hi. So I'm going to pop them down below. Good afternoon to you, Alicia. Thank you very much. And we have another person that was kind enough to comment. So they said, where can we find this checklist? So that checklist we created, we will be including that in our usability product. So if you buy our SYS 048, that will be included there. I will make sure afterwards that I've got it saved in that folder. So if you buy SYS 48, that's where you'll find it. In our other templates, we're going to be selling those individually as part of training. So if you're interested in that, stay tuned over the next couple of months here, and we're going to be releasing a bunch of trainings on usability. We've already released one on formative. We have one that we're just finishing up on another topic. So we're going to be providing that over the next couple of months here. But if you're interested in that checklist, that's part of our procedure. So thank you for asking that. And Alicia was very understanding here and said, I'm having problems sharing. Yes, we deal with the technical difficulties, but it goes a little slower when it's live. So thank you very much for your patience. If anybody else has any other comments, please put them in there, and I will share you in the live feed as well. So the next item that I wanted to cover here, number 6 in the list, is how you do the process. So it starts with describe the process, then what are your inputs, what are your outputs, what tools do you use, who does it, and then step 6 is how is it done, and specifically what we're looking for is SOP, forms, logs, templates, that stuff. So that's what you would indicate. You might also have some standards that are included there as well. So that's, you want to ask those questions. So that other question, where can we find this checklist? It's SYS 48. So I'll actually put that in here for you. So we'll just put tab SYS 048, and then we would have also the checklist, and you would also have I believe there's a template for the summative validation report as well, or not report, but protocol that's included in that. So those are the 3 things that I think you get when you purchase that package. So just an example of things that you might be documenting if you were going to audit this. And then the next thing that you would look at if you're doing this process, step 7, we would ask, what are the metrics for this process? So for metrics, it might be how often, or you could ask how many use errors. That might be a question. Another question you might ask, well, I guess the way we can cover this is do this a different way. These are metrics, and we'll just say one of them is use errors, would be one that we might have. Another one we might have would be frequency of post-market surveillance. Another thing that we might look at for a metric is number of people for validation. So those are just some examples of metrics you might have for that process. Up here with who's going to train, we might be having the team lead for the design team, and then we might have a UX designer that is a consultant, and then we might also have a human factors consultant that's helping with writing protocols. Up here for the software, we just might have, this might be something like Grand Avenue. And by the way, they've got a new, Grand Avenue is a software EQMS system, and they just came out with a new beta version of their risk management module that I got to demo last week. So that was pretty cool. And then the usability engineering file, this would be, you might have a checklist for this. It might also be in your technical file / medical device file or DMR. So that might be things you look at in here. These are the I was trying to indicate the different things you'd have here. You'd have your indications for use. What else would we have? User. What is the? It's the intended users. Users, intended patient population, intended use environment, and then the user interfaces, because you'd have many of those. And one of the things that they want in your usability engineering file, they want you to have a user interface specification. So this would be an output, a requirement specification. What are the required outputs, or what is your required specification of what kind of user interface you want? Do they need something that's a touch screen? Do they want something that's keyboard access? Do they want something that's a pen? Do they want knobs, buttons? Do they need foot controls? What kind of user interface does the user want? And that's more of a stakeholder item. It's not a regulatory requirement. So that's something you want to keep in mind there. But as you can see, we're building a little mind map here as we build out this. It's very similar to sort of like a brainstorming activity, but the way I've done it, everything is organized, and you can see associations between different things. So rather than just randomly brainstorming and having arrows all over the place, this tool allows me to keep my mind mapping more organized. And I can move things around. Like I say, oh, that doesn't belong here. That belongs up here. So it's very quick, automatically reformats things, and it keeps it very pretty with lots of color here. So we can also shrink it down to size, and I can export it, and I can also do other stuff. One is asking what kind of software I'm using to present for this. So this is Wondershare eDrawMind, and that's up in the very top left-hand corner here where you can't really read, but it's called Wondershare eDrawMind Pro. It's the Pro version, and I got this package. It was fairly inexpensive, but it's given me a lot of tools that I can do this. So I'm having kind of fun with this. But because my tablet's not playing nicely here, I thought I would use this tool to show you this is the steps that I would go through to do an audit of usability. So I would ask the 7 questions for the process approach to auditing. I'd ask the person that's the group lead to describe the human factors process, and I wrote UF, and what I really meant was HF, or usability. And then I would ask what the inputs are. That's my use specification. They should be telling me it's a use specification. I would ask, what are your outputs? They'd say the usability engineering file. I ask them what software. They'd say, well, we're using checklists, and maybe we have a QMS system like Graham Avenue. I'd ask them who does it, the team lead, maybe a UX designer and a human factors consultant. I ask them how it's done. They give me a copy of their procedure. I'd ask them what metrics. They'd say, well, we keep track of use errors. Yes. And Tiffany says she loves the color. I do too. Thank you. In fact, my purple's my favorite color. So Alicia likes this tool as well. So we're getting a lot of popular things about the software. But after you've done the interview with a person and you've built your framework for your process approach diagram, your turtle diagram, the next step is decide what kinds of follow-up trails are you going to have. So I'm not going to look at 100% of this. This is an audit. I'm just sampling documents. So I got to decide what things do I want. So I might say, well, how many, this could be down here again, like how many usability engineering files? How many usability engineering files? And so that would be another metric. And based on, if they say they only have one, well, then narrows it down. Then I got to sample more out of that one. But if they told me they had 5 different usability engineering files, I might build a matrix, maybe a 5x5, say, these are the 5 things that I want from these 5 usability engineering files. And that's 25 samples that I might ask for. So that gives you an idea of what you might ask for. And it kind of looks like I might be running out of battery here. So it's telling me to stop talking. But that's how you do it. You go back through here and decide what records I want to sample. Indication for use. Maybe I don't want that, but maybe I do want to look at training for the team lead. Maybe I want to look at their procedure. Maybe I want to look at a protocol. Maybe I want to look at what kind of post-market surveillance they've done. Pick some of the records, sample those, and see if they comply with the procedure and see if they comply with the standard, the IEC 62366. And that's how you audit this process. In any kind of process, you can use this 7-step approach. Describe it. What are the inputs? What are the outputs? What kind of software tools, calibration equipment you use? Who does it? How is it done? What procedures, forms, and templates? And then what metrics do you use? And then you sample from that. And you can draw it as a mind map. You can draw it as a turtle diagram. You can have it as a numbered list, 1 through 7. That's how we often do it in our audit reports. And then we just copy and paste the 1 through 7, 1 through 7. It's a very easy way to do it. And I'm glad people like the colors and they like the tool, but it's a systematic way so I don't have to memorize, I don't have to create a big, long checklist. Like, where's your audit checklist? I don't need to create an audit checklist. We did create an audit checklist, but I could just ask the person instead. Or you could go element by element that I described earlier. And this was more fun and this was more organic. So I think it does a better job of getting you to understand whether the person knows their job and is doing this right. So I hope everybody found this sort of, there were some hiccups here as we went along due to technical difficulties, but I hope you found this helpful. And if you want more training like this, let me know, put it in the comments below, and we will definitely do more because this was fun. I'll just do a little bit of technical troubleshooting beforehand and get this tablet working right. And we'll bring in more of this mind mapping because people seem to like that. So see you next week and looking forward to your comments. Have a great weekend and a holiday weekend to you. Bye-bye.